Hi, I just got a report from the oncoming nurse. She gave me the S-bar. Important information about this gentleman is that he's 46-year-old male, here for a routine visit, physical exam, and he is complaining of some constipation and some blood he's noticing when he wipes after a bowel movement. He thinks it might be hemorrhoids. He did have a negative occult blood test. Very vague on his overall health, other than he looks generally healthy, and he denies any family history of GI issues. And so we're going to just do an abdominal assessment for the provider, see if we can get some more information for him to go on before he makes his decisions. So I am going to wash my hands, knock on the door. Hi, Martin. My name's Tisha. I'm the nurse today. I wanted to come and introduce myself. We're going to be doing an assessment today, mostly focused on your abdomen, since you did tell the previous nurse that you were having some issues with constipation. So we'll go ahead and investigate that, see if the doctor needs to do any further testing regarding that, and what we can do to help you. So I'm going to give you some privacy. We're going to go ahead and close this curtain. I'm going to go ahead and get your vital signs, because I did not see them posted in the computer. Go ahead and check I'm going to get your arm, if that's okay. Is this arm okay to use? Perfect. Okay, what is your normal blood pressure? Okay, that's pretty good. So I think this is hooked up. Just get your blood pressure really quick. Now, are you comfortable? Okay, good. (110/84). I'm going to go ahead and take it off now. That's not a bad blood pressure. I'm going to get your temperature. That's okay. This is going to go to your forehead and around. Alright, so we'll just go ahead and get that. 97.6. That's a good temperature. And then if I can use your finger, we'll go ahead and get your oxygen level. Okay, looks good, 98%. So I'm lastly going to go ahead and get your pulse. We'll listen for a full minute, and I'm going to listen to your heart. So we're going to pretend that we listened for a full minute and got 60 for the pulse, which is a good number. Overall, you appear healthy. Your vitals are good. Just a little bit more questions on this constipation you're experiencing. How long have you been experiencing it? Off and on for the last 6 months? Okay. And then when you say constipation, like how often are you going? Okay, once every 2 to 3 days. Okay. And are you straining to use the restroom? Yeah. All right. And you're associating any nausea, diarrhea, bloating, distension as far as your abdomen? That's not normal with it? Just the constipation? Okay. I was wondering, do you have any pain down there? Any abdominal pain? Any of that? Okay. I did read that you didn't have any, history of complaining of GI issues, so sounds like that you're not having trouble, keeping food down or any chronic history with GI issues, so that's good. I noticed you're 46 and not quite 50. Have you had a colonoscopy yet? Okay, no? Okay. And how about a Cologuard? All right. Cologuards aren't for everybody. Sometimes if you have certain symptoms, the doctor's still gonna want you to have the colonoscopy, but I just thought I would ask so that we can get him that information. Now when you're having this blood, is it just only on the toilet paper? Is it a dime size, a nickel size? Okay, about a nickel size, okay. And are you noticing any clots? Okay. And you're not seeing any in the toilet bowl itself, no redness or pink water or any of that? Okay. All right, sounds like you're just having, if I'm understanding you correctly, you're just having some maybe between a dime and a quarter size areas of blood, and it's a bright red, or yes, bright red blood after your bowel movements, but not in between. Okay. And you are straining to go. Have you felt any hemorrhoids? Because you said you didn't have a history of hemorrhoids, but have you felt any abnormal bulging down there, or felt any burning down there when you're trying to have these bowel movements? No? Okay. Well, that is good to know. I was gonna just quickly ask you about your diet. Okay. So you say you, what would you say you eat in a typical week, or how many times a day do you eat, and what are you eating as far as the food groups go? Okay. So if I understand you correctly, you're saying you eat, you work a lot, so you eat in your car sometimes, and you don't always, cook, and you are single, so you do eat fast food, maybe, what did you say, 2 to 3 times a week, but you are incorporating a vegetable, at least every other day, and that you like apples for fruit, and that you drink lots of water. Okay. All right. And have you tried anything over the counter for the constipation, or any items of food that you know might be helpful for constipation? Not yet? Okay. So if you don't mind, I'd like to start the abdominal assessment. If it's okay with you, I'm going to go ahead and pull the blankets down and expose your abdomen. We're going to keep your privates covered though, so don't worry. And right now I'm just going to take a visual assessment of your abdomen, see if I see anything abnormal, if everything looks pretty symmetry, if there's any bulges, any pulsations that I can see, any distension, everything, appears to be visually sound. I don't see any drainage from the umbilicus, no redness anywhere. Are you having any discomfort anywhere else? No? Not in your back or on your sides? No? Okay. So after the visual assessment, I'm going to go ahead and listen to your bowel sounds. Okay? We're going to listen to a few areas. We'll start in the right upper quadrant. Listen for a full minute. I'm just going to go clockwise, okay? And listen to each one of your quadrants. So we're going to pretend that I listened for 5 minutes, just to be able to rule out not having absent bowel tones. So your bowel tone should be anywhere between 5 and 30 clicks, and I heard anywhere between 5 and 12 throughout, in between, so they are on the low side. So definitely sounds like you might have some issues with constipation, given everything else that you've told me. Next thing to do is just kind of feel around on your stomach. We're going to do some percussion and see if we can feel any signs of fluid in the abdomen. Okay, so we'll start with the right upper quadrant. Going clockwise. Okay. All right. And I didn't feel anything abnormal. Lastly, I'm just going to listen to your vessels. Listen to your aorta down here. Make sure that everything's flowing correctly. Listen to your renal vessels. Femoral. Ischial. So all your vessels sounds like they're flowing fine. I don't hear any constrictions or anything, so nothing there to be worried about. If it's okay, I'm going to go ahead and put your gown back down. Okay, and we'll go ahead and get you covered back up if that's fine. Thank you for being a good sport with the assessment and letting me ask you some questions. So as far as your diet goes, I did want to let you know that there are things you can do for constipation that don't involve medication. Those are like fruits, and increasing your fiber in your diet, whether that be a bran cereal or anything like that. They also have fiber pills and Metamucil over the counter if you're a busy person, which it sounds like you are. Might not always have time to get to the store to get like actual food items with fiber in it, which I get. And I commend you for drinking lots of water. That should also help keeping you regular. So keep doing that. And I like to drink prune juice sometimes, and I'll give prune juice to my grandkids if they're having issues with their bowels. I know that you said that you work a lot, and I work a lot too, so I get it. I'm just gonna throw it out there. They have places that will design meals for you that you can have delivered to you if you want to think about maybe incorporating more of the fruits and vegetables into your diet, and see if that might help keep you a little bit regular, or maybe even just picking up some dried prunes and snacking on those. All of those things will help. And sometimes the ordered meals can get expensive, so there's always the meal prep, which also takes time. I do realize that, but that is an option. The provider is going to be in shortly. He's going to go over all of the assessments that we did together, and then you guys will come up with a plan and decide whether you need that colonoscopy or not. All right, so did you have any other questions for me before I leave the room? Okay. Yeah, you can get fiber over the counter in a pill form. I'm not saying that's better than the food form, but it is a helpful tool. All right, so then I'm going to go ahead and wash my hands, and I'm going to input all this information into the computer. It was nice meeting you, Martin. I'll see you after your visit with the provider.